Hello and welcome to my Facebook Live video series. My name is Kristen Grace McGarry, and I'm an integrative holistic healthcare provider. I'm a licensed acupuncturist. I'm certified in functional medicine and certified in advanced cranial sacral therapy and somato-emotional release and many other techniques. I have lots of great tools in my toolkit, and I am creating this live series for you on all things health and wellness, especially during this pandemic. It's a great time to upgrade your health and your life. So I want to give you lots of my clinical pearls from the last 23 years of practice and study so that you're empowered and you have everything it takes to come out of this pandemic thriving, better than you were when it began. So today I'm going to be introducing you to a very important concept that not many people are speaking about. See, if you have symptoms and you've gone to your doctor, you've gone to your naturopath, you've gone to your chiropractor, you've gone to your acupuncturist, maybe you even took herbs or homeopathy, perhaps you just stuck with the Western medical model and you did medication, but it didn't really resolve what's going on. Maybe it helped mask the symptoms a little bit, but it didn't really get to the root. Then keep listening, because what I have to share today could be the missing link that your doctor, your naturopath, your chiropractor, your osteopath, your acupuncturist didn't tell you about. And it's actually the topic of my third book, which isn't out yet. My first two books are out, and you can learn more about my books on my website, guthappyketo.com. Until the third book's out, I want to give you the information today because that book's not going to be published till next year. So this topic is blocks to healing. Your body is designed to heal, regenerate, and be whole right now. And if it's not, it's likely because there's a block. So what are some of these blocks to healing that could be preventing you from living your most vibrant self? I'm going to share it with you. First, I'd like to say hello to Dennis, who just wrote a message. Hi, Dennis. Thanks for joining me. If anyone has questions about potential symptoms and blocks to healing that you may be having or that you're curious about, please type them into the comments. If you are listening to this as a replay, I do my best to check once or twice a week, so I will answer when I check. What do you think might be a block to healing in your own life, in your own body, in your own relationships? Type in some of your guesses as I start to share about blocks to healing. Because your body's designed to heal, regenerate, thrive, and be amazing and strong and balanced, and it may not be if you have any symptoms, like low back pain, like a stuffy nose, like environmental allergies, gas and bloating, burping after you eat, diabetes, cardiovascular disease, inflammation, joint pain, headaches, the common cold. Many of these things should be resolved. If they go on and on and on, or you get them every season, or if you eat a certain food and you get them, it shows your body is not in balance. And some people think, oh, it's just aging. Other people think, oh, it's just allergies. I'm just allergic to pollen. Well, that's actually a sign of imbalance. There's something going on. Your body should not be reacting to things in your environment in such a way. And so let me explain how some of these blocks to healing can actually prevent your body from doing what it's designed to do. I will begin with scars because it's a little edgier, and it's Saturday and I'm feeling edgy. So I want to share something that may be completely new to you. Scars can be a block to healing. You may be thinking, well, how can a scar from 20 years ago or an old surgery or an old accident actually block your body from healing? Well, I'm going to explain a couple of different ways that a scar can block your body from healing. First of all, wherever there's a scar or a surgery or stitches or an old injury, there is often a fascial restriction. What that means is your connective tissue might be bunched up and twisted in such a way that it doesn't allow for fascial glide. Now, fascia is this connective tissue. It's like this beautiful webbing from the top of your head to the tip of your toes. It's amazing. And this sounds a little gross, but it's true. In cadaver dissections, if you move something inside the head, you can actually watch the big toe move because there's a theory of fascial continuity. And this theory means everything's connected. Everything is connected in your body, and it's proven. It's so cool. So if you have a surgery, a scar, an injury, you may have a fascial restriction. Things are gummed up in that place, and it doesn't allow for your fascia to move properly. And this can impede your body's ability to fully heal that area, that old injury, that scar tissue, etc. Next, a scar can actually impact your nervous system long term. Here's my analogy. Let's say I have a surgery on my arm. Maybe I broke my arm and my bone is sticking out, so I have a surgery here. And I have a plate put in and some bolts. I have a scar from that. My nervous system, the cells in my tissue and my nervous system, two things, remember this injury. They remember the trauma of the surgery and the trauma of the injury. And that gets locked into my system. And so it's easy to understand if you've had trauma. Let's say a car accident and you were hit from behind. And every time you look in the rear view mirror, and you feel like someone's coming fast behind you, you might clench your body up. It's because you have cell memory. Your body remembers and your nervous system remembers. And it does this for a good reason. It wants to keep you safe and protective. It wants to help you live, stay alive. And so these things get stored in our tissue and our nervous systems. When you have a scar, that injury, that trauma, that surgery is also stored. And it's as if it's cycling through that trauma again and again in your nervous system. And so if you don't address that scar properly, your nervous system will continue to register, there's a problem, there's a problem, there's a problem, and it won't do its other jobs, which are numerous and very, very important, or it won't do its other jobs as well. And I believe you deserve to be operating optimally in your life and your health and your body and your brain and your nervous system. So the scar can impact your fascia, your nervous system, cell memory, and from an Asian medical perspective, a scar, a trauma, a surgery severs, it cuts through the meridian system. Well, what's the meridian system? In Asian medicine, the meridian system are channels, these pathways of energy in your body where qi and blood flow. It's different than your veins and your arteries. And Western medicine can actually measure these now. They couldn't before, but we still knew they existed. We still understood they existed for as long as we have. And Asian medicine is about 6,000 years old. It's really stood the test of time. They understood a lot about these energetic pathways called meridians. Now, on the meridians are where the acupressure and acupuncture points are. It's where they live. And so when you have a surgery, a trauma, an injury, it can sever these meridians. Well, each meridian goes to at least one organ. And so if you don't have the free flow of qi and blood flowing properly to all of your organs, not just feeding them blood, but feeding them vital life force energy, then you will have a problem eventually in that organ, in that body part at some point. Or along that meridian, that channel of energy, there could be a stagnation. It could not be flowing well. And this impacts everything in your body and well-being. including your spirit, your emotional body as well. So just a scar can have huge impact on your body that you may be unaware of. I'll give you a super common example that I'm almost guaranteed you have, is a belly button. A belly button is your first scar. And very few of you, if any, have probably ever had your belly button treated as a scar. So there's a therapy that I use to work with scars. It's called neural therapy, and it originated in Germany. It's true, I am German, so I am slightly biased, but German medicine and those German physicians are brilliant. And I'm very, very, very honored and grateful to have learned from some incredibly skilled doctors from Germany and Europe. Neural therapy helps release fascial restrictions. It helps down-regulate the nervous system and reset it so that your nervous system doesn't mistakenly keep going back to this old scar and injury thinking it's still a problem. It wakes it up and says, oh, I'm done with that. That was 15 years ago. Oh, great, thanks. It also can help bring the meridian systems, the channels of energy back together. It can help them heal together, even if they've been apart for a very long time. So neural therapy is one recommendation for all scars and old injuries and traumas. Let's go back to other blocks to healing. So scars are a big one, and I find this in many people. And a scar can be in a different part of your body from where a symptom can be, and they can still be very related. They can be very connected, and treating that scar on the opposite part of the body can create huge changes in your physiology and your biochemistry. It's remarkable. Other blocks to healing. I'd like to just name some others. And you'll have to read my book, and you're welcome to have a consultation with me to individualize things for your body to determine where your blocks may be. Because there are many of them, and I don't expect you to become an expert on blocks to healing to figure it all out on your own. That's why I do what I do. That's why I'm so passionate about sharing this information with you, because I can guide you in this way. You don't have to do it on your own. And most naturopaths, most doctors have no clue about all the blocks to healing and how to individualize treatment. They're doing their very best with the tools they have, but most of them don't have the time, the energy, and access to the education to actually get to the root of all of these challenges that you may be experiencing. So that's where I come in to be part of your team, to work together with your other healthcare providers. Blocks to healing. Other blocks to healing, although controversial, can be heavy metals, such as mercury, amalgams from dental fillings, but also from eating a lot of fish. I grew up my youngest years in Chicago, and I ate king salmon out of Lake Michigan. And Chicago has one of the highest contents of mercury in the air in our beautiful country. Of course, this changes slightly. There are some other industrial cities that have high mercury, but Chicago is known in the past of having some of the highest. So I was breathing in mercury. I was eating mercury. And we had mercury thermometers. And fortunately, when the thermometer broke, I did not play with the mercury, but my sister did. So I went and told my parents about it, and she played with it. So she has a little bit of mercury as well. I also had I had 4 amalgam fillings as well. And what research has shown, although controversial because of the Dental Association, American Dental Association, I write about this in my 3rd book that will be released next year. I go in the history of the Dental Association because it started very differently than how it is today. In the past, they were very anti-amalgam, anti-mercury. And then there was some politics involved, and they turned into being pro-mercury, pro-amalgams. And I have 2 dentists in my family, so I understand. So every time I was chewing, what science says is that I'm releasing mercury vapors into my head, into my brain. No bueno. So I did a lot of testing, not just hair analysis. I did a lot of other testing. I took a provocative agent for 3.5 days, 4 days maybe, and then I caught my urine for 24 hours, and I tested that urine to see what the provocative agent was making my body excrete. It was a chelating agent that would make my body excrete stuff, and my mercury, the mercury, was through the roof, off the charts. And so my body was excreting a lot because I had a lot stored. And so that had been a block to healing for me. And it wasn't until I really understood and got to the root of it that I started to notice pretty significant changes in my neurology, in my brain. My balance got better. My memory improved. The fatigue I was experiencing lifted significantly. So for me, that was a block to healing. Now, I've worked with plenty of other people where that's not a block to healing for them. But I like to just mention that heavy metals can be. And it's not only amalgams or mercury. There's lead and all sorts of things that can come up for people that can be a block to healing. Another block to healing can be latent viruses, bacteria, or molds, fungi, mycotoxins. These can be either obvious in the body or they can be suppressed. For example, Epstein-Barr virus. Some people never have a symptom. Maybe they had mono when they were a teenager, but they may not have many symptoms now. That virus being underneath the surface of their body, of their biochemistry, their metabolism, their immune system, it being there latent can be a block to healing. So there are very specific ways to address those latent viral infections. Herpes can be another one. Old bacterial infections, old strep throats. If someone had a lot of strep throat infections as a child, that, because it's often not treated properly, it's often given a lot of antibiotics and they don't understand how to go back and really work with that, that can be a block to healing in your adult life. Mycotoxins, mold exposure, can be a real block to healing. So these are some. There can be lots of other blocks to healing. For example, if your viscera is restricted. Viscera is a word that means organs. So the fascia hold your organs in place. And if you, during birth, if you had some trauma during birth, maybe your viscera got stretched and your fascia got stretched in a certain way, and now your viscera, your organ, is twisted a bit in your body. And people may not understand that this can be a real block to healing. It can impede your ability to digest your food. It can impair your ability to detoxify through your liver, to digest fats through your gallbladder and the gallbladder ducts, your duodenum. All sorts of things can get like twisted and a little bit off. And that can be a real block to healing that people aren't aware of, that certain kinds of body work like visceral manipulation, sometimes fascial release, myofascial releases, can really free up. And then these organs start to work better, your whole system starts to work better, all of your systems start to work better, and boom, you can now thrive. Now there can be other blocks to healing. There can be osseous, bone restrictions that can block healing. Some people don't realize that your cranial bones actually move. This was proven many, many, many years ago by Dr. Sutherland, that our cranial bones that we thought were fused together are not. They are actually movable. And these cranial bones in our head can actually get tweaked and locked in positions that are not healthy or optimal. And guess what's underneath those bones? Your brain. It can impact your brain chemistry. It can impact your hormone system because guess what? The master gland, your pituitary gland, is in your brain, and so is your pineal gland. All of these things can get impacted when these bones are off. And not only in your head, in your entire body. Your spine, your sacrum, your knees, your feet, your ankles, your toes, your arms, your shoulders, your chest, your thoracic inlet, your respiratory diaphragm. These can all have certain kinds of restrictions that can be real blocks to healing. They can block your body from doing what it's designed to do, which is regenerate and be whole and vibrant and thriving. There can be other blocks to healing. I'm giving you lots and lots of little tips and little teasers on all the blocks to healing, but there's more. There's a long list. So I won't go through all of them, but I'll give you a couple more. Other blocks to healing could be food sensitivities, and you're unaware of them. There are hidden food sensitivities. This means an elimination diet will not find them. This means if you just stop eating them for a couple of weeks, it will not fix it. Hidden food sensitivities can really block your ability to heal and digest your food properly. It can block your gut's ability to heal. It can block how you absorb your nutrients. And most importantly, in the time of this pandemic, is it can impact your immune function. If you're eating things that you have a hidden sensitivity to, then your immune system is going wonky. And it's not regulated, it's not balanced, and it won't be as strong. And we really need all of our immune systems right now to be very strong and balanced. Now, these hidden food sensitivities are tricky because you may not notice a symptom right away. It could be a day, it could be a week, it could even be 3 weeks before you would feel a symptom from a food you ate. That's shocking to a lot of people, 3 weeks. It could be that long. So if you're doing an elimination diet for 4 days, that is not going to do it. Even if you're doing an elimination diet for a week, it's not going to do it. You're not going to be able to tell 3 weeks later if the carrot you ate that was cooked versus raw is actually the problem. So there are very specific tests. Now, I don't trust many labs because a lot of labs give false positives and negatives because their technology is not as fine-tuned as it could be, and their practices are not as specific as they should be and clean. So there are very few labs that I trust. And so working with a very trained healthcare provider like myself and someone who really understands the lab aspect of it is very important when you're doing hidden food sensitivity testing. And this can be a block to healing. Next, another block to healing. We've been talking about many different physical blocks to healing. We touched on mercury, we touched on heavy metals, we touched on mycotoxins, we touched on latent bacteria and viruses, we talked on food sensitivities, but there are non-physical blocks to healing. For example, if you've experienced a trauma, if you have post-traumatic stress disorder or complex PTSD, this can be a block to healing. It literally impacts your nervous system, which directly impacts your immune function and your endocrine system, your neurology. It is huge. They have done incredible research on young children who experience trauma, and they have a statistically very, very high chance of getting an autoimmune disease because of the kind of immune dysfunction that goes with trauma, that goes with nervous system stress. This is huge. This can be a huge block to healing, and there are many different modalities to address it and fully heal from PTSD. There is a lot of hope for those of you that may be experiencing that symptom. If it's not complex, if you're not bound to your house because of the level of trauma you've had, you're lucky. And it's still significant in your system. It's still valid and important to address it emotionally, physically, spiritually, and energetically. Very, very important. This can be a huge block to healing, even though it's more difficult to see. I'm trained to feel and see those deeper patterns in your being, in your thinking, in your emotional body, so that we can really peel off the layers of potential blocks to healing so you can thrive. Okay, other blocks to healing. Certain medications can be blocks to healing. They can be actual blocks to your body doing what it is designed to do. There are other dental issues that can be blocks to healing. For example, root canals can be, for certain people, a real block to healing. I did a Facebook Live on dentistry and the connection to your immune system. And every single tooth in your mouth is connected to a vertebrae, an organ, a gland, a meridian, a body part. If you go on Google search images and look up biological dental chart or holistic dental chart or tooth chart connecting all the organs to the teeth, those kind of words, you'll find what I'm talking about. It is super cool. So if you have something going on in your mouth that's unresolved, that can be a real block to healing, including gum pockets, unresolved inflammation, dental issues. Braces can be a block to healing. If you had braces in the past, every time they cranked on those braces, depending on where your cranial movement was, were your cranial bones in flexion or extension, that can actually determine and pull certain bones and fascia out of place, tissues and muscles out of place during those braces, and it can cause TMJ and real blocks to healing. So there are many, many layers to blocks to healing, which is why I wrote a book about it, because I'm so excited to get it out there into the world. Pain can also be a block to healing, and the underlying root of why the pain is there can be a block to healing. So a very holistic approach to working with pain is necessary to remove blocks to healing. And I did a video, a Facebook Live on pain and how to deal with it in a very holistic way a couple days ago. So please go check that one out. Really, really good information. And I promise you, I give you modalities that you have never heard of before, like perineural injection therapy. Now you've heard of it, but you'll learn more in that video. So I hope that sharing these various blocks to healing has been helpful. There's more. Chemicals and pesticides, glyphosates, weed killers like Roundup and such. These kinds of chemicals and pesticides in our environment, in our water, in our air, on our food, can be a real block to healing in our bodies. It can gum up the system. I'm going to leave you with one more piece, and I wish I had said this earlier, but I'm going to say it now, so hopefully you've listened in for the whole talk. This is so important. It's called body burden. And your body can become overwhelmed with toxins and chemicals. So I'm going to leave you with the idea of body burden. I'm going to let that percolate, and I'm going to do a whole Facebook Live next week, this coming week, on body burden. So we have the time to really dive more deeply into that, and I can explain all the nuances. But it's very much connected to blocks to healing. All right, I hope that this has been informative, that you've learned something, that you're feeling more inspired, more empowered about your body and your health and your life. And you can utilize these tools and this information to build yourself up, to emerge from this pandemic even stronger and healthier than you were when it began. I'm Kristen Grace McGarry, and you can find me on my website, that's not it, guthappyketo.com, guthappyketo.com. I have blogs there for you to read. I have blogs on COVID. I have blogs on stress. I have blogs on prevention. I have blogs on food and nutrition and functional testing. I also have tons of scrumptious recipes. Check out my recipes. I think we just posted my latest favorite banana muffin recipe. I have banana trees on my property here in Costa Rica, and they were going crazy. So I made some gluten-free, dairy-free, vegan, protein-heavy with collagen banana muffins. So check those out. I also have yummy flourless avocado brownies. I have all sorts of yumminess, so check out my recipes. And I look forward to seeing you tomorrow on my next Facebook Live. Let me share with you, tomorrow we're gonna talk about energy zappers. So stay tuned. Tomorrow, I look forward to being with you again. Thanks so much for joining me. Have a great weekend. Happy Easter, happy Passover, and many blessings. Be well. Bye for now.